Hi folks, welcome back. In today's video, we're going to start a series of videos looking at complications or side effects from common urological procedures. Today's video is going to focus on a TURP or a transurethral resection of prostate, still globally the most commonly performed surgical procedure for men who have bothersome urinary symptoms related to a benign enlarged prostate. For those of you new here, my name is Dr. Charles Chabert. I'm a urologist and director of the prostate clinic located on the Gold Coast. And as always, if you get benefit from the video, please give it a thumbs up and subscribe to the channel. Okay, let's get into things. So a TURP procedure is still by far the most common procedure for managing bothersome urinary symptoms related to a benign prostate. The indication really for proceeding on with this treatment is either if men have bothersome symptoms despite taking medication, prostate medication, or alternatively, they are intolerant of the medication, or if people have complications from their BPH or their benign enlarged prostate. Complications can include not being able to pee, having recurrent urinary tract infections, developing stones in a man's bladder, or alternatively having problematic bleeding from the prostate. So certainly if there's a failure of medical therapy, or alternatively if there are complications from BPH, we proceed on with a TURP. Now, in today's video, I want to focus really on the complications or the potential side effects so that you can be better informed with regards your choices when you're deciding if a TURP is appropriate for you. I want to break the complications down into three main categories, really. Those that are associated with the operation itself, so immediately at the time of the operation, and those in the post-operative period, which we can divide into two categories: early complications and late complications. If you'd like to be part of our growing community, please follow the link in the comment section down below and sign up to our free newsletter that comes out on a weekly basis, keeping you up to date with all aspects related to prostate health and various treatments that are available for men. Now back to the video. So let's start by having a look at the complications that can occur at the time of the surgery. Now, the first one of these is something called TUR syndrome, which is a condition whereby men absorb too much of the irrigating fluid when a man is having the TURP operation. Now, if I take a quick step back, the way the procedure is performed is with a telescopic camera that's placed through the urethra, and sequentially pieces of prostate tissue are removed to, in essence, excise the overgrown tissue in the prostate and to create a larger channel and therefore to unobstruct the bladder. Now, traditionally, the TURP operation has been what's called monopolar, and the irrigating fluid, so the fluid used to wash out and to facilitate the surgeon being able to see when they're doing the procedure, has been something called glycine. Now, without getting into the specifics, in essence, the longer the procedure goes on, the greater the risk that that man can absorb glycine. And if there is absorption of glycine, in essence, it can dilute someone's bloodstream to the point where they can get something called a dilutional hyponatremia. In essence, what that means is that their sodium level becomes very, very low because they've absorbed too much fluid. Now, newer techniques include things like bipolar TURP. And with a bipolar TURP, normal saline is used rather than glycine, and therefore the risks of developing a dilutional hyponatremia are minimal. So that's the first thing to be aware of. Now, you may be aware that the prostate actually is a really well perfused structure, which in essence means that it's got a fantastic blood supply. And the larger and the more complex shape of prostate, the greater the risk of bleeding intraoperatively. So at that time when the surgeon is trying to remove the excess tissue, there's a greater risk of bleeding. And that increased risk of bleeding can, in its most severe circumstances, translate to a need for a blood transfusion. And certainly in contemporary data, and so this is from a published meta-analysis, which in essence means that this is the pooled data from a variety of different randomized controlled trials, in excess of 100 randomized controlled trials looking at approximately 8,500 patients. The transfusion rate is around 6%, so not insignificant. The final intraoperative complication to be aware of really is the potential for damaging the bladder or damaging the urethra. Now, damaging the urethra is arguably more common than a bladder injury and can be related to the passage of the instrumentation to actually get it to the site to do the operation. One of the challenges with the TURP is that the caliber of the camera and the equipment is quite wide, and this does run the risk of damaging the urethra, particularly in the bulbar urethra, and can lead to a later complication, which we'll get to in a moment. So there you have. Those are the intraoperative complications for you to be aware of. TUR syndrome, number 1. Bleeding, potentially requiring a blood transfusion, number 2. And number 3 is an inadvertent injury to either the urethra or alternatively the bladder. Let's turn our attention now to looking at early complications. So these are complications once the surgery has done and can be present within the first week or 2 following the procedure. Now, the first one of these, which is the most common, is a urinary tract infection. And so this can manifest after surgery as some stinging or burning, discoloration of the urine, maybe a malodorous change, so a change in the smell or the odor of someone's urine. And it's possible for a man to notice increased frequency, urgency, or potentially leaking urine before they make it to the toilet. That can all be part and parcel of a urinary tract infection. Obviously, if someone develops bugs that gain access to the bloodstream, there is the potential for that man to become quite unwell with high temperatures and rigors and need readmission to hospital. So a urinary tract infection really is one of the most common side effects that we see after a TURP. It's important to note that the probability of a UTI across the board is around 5%, but that risk is greater if someone has had a catheter or multiple catheters prior to surgery, or if that man has had urinary tract infections leading into their surgery. So it's important when you're deciding on your treatment, and certainly to go in with insight, that there are factors that influence the probability of these side effects happening following treatment. Hematuria or clot retention is the next early potential side effect. Now, hematuria is the scientific name given to the presence of blood within urine, and hematuria is exceedingly common following a TURP procedure to the point where every man will have some degree of blood within his urine. Now, if it gets particularly heavy, there's the potential for developing clots. And if clots do develop, they can occlude the outlet pipe and a man can develop clot retention. Now, that's the situation whereby he bleeds to the extent that he blocks off the outlet pipe, cannot pee, urine accumulates in his bladder. It can be painful, and that man really needs urgent attention to replace a catheter to allow decompression of the bladder and washing out of those clots. Now, the probability of this, when we look at that meta-analysis, is around 4 to 8% of the cohort that have a TURP procedure. All right, let's look at the final early complication, and that really is acute urinary retention, and that can be associated without the passage of clots. And some people might say, well, hang on a minute. I've had a procedure to remove overgrown tissue, to unblock my bladder, to try and improve my urinary symptoms and make it easier for me to pee. Why on earth would I end up in the situation whereby I cannot pee at all despite having had that treatment? And the explanation for that really goes back to the procedure itself, whereby we have to irrigate or wash fluid into the bladder to facilitate vision. And when we do that for a longer period of time, there's always the potential for the detrusor muscle. And the detrusor muscle is the muscle in the lining of the bladder. And that muscle can become a little bit stunned if you like. And effectively what that means is it doesn't contract properly for a period of time. And there will be a proportion of men, around 5% of men who have a TURP procedure, that simply don't pee initially after their catheter is removed. Now, for the majority of men following a TURP procedure, they will have a catheter for a day or two. Most men will pee when that catheter comes out, but as I say, around 5% of men won't pee. If that is the case, they'll require obviously another catheter to be put in place, an additional period of rest, which can be up to a week, sometimes longer, but that facilitates recovery of the detrusor muscle, and we see that those men do subsequently pee thereafter. The situation to be aware of that increases the probability that a man won't pee after surgery is in that situation where a man has what's called chronic urinary retention, implying that he poorly empties his bladder, and this situation has been around for a long period of time. The bladder itself is used to being over-distended and retaining sometimes several hundred mils of urine. That is a specific situation that can slow down recovery. And that's important to know your particular metrics before you proceed on with a potential TURP. Okay, let's have a look now at late complications from a TURP. And by late, what I'm implying is months or years after a man has surgery. The first one to be aware of is a urethral stricture. Now, when I was talking about early complications from a TURP, I was mentioning damage to the urethra or potentially the bladder. Now, longer term, if there is some damage to the urethra after surgery, the urethra is the outlet pipe of the bladder. It can scar and heal with time. And when we have scar tissue in the urethra, we run the risk that that scar tissue can contract and cause obstruction. And the manifestation of that is that men present with symptoms very similar to those that they had that led to them electing to have surgery in the first place. Now, one of the challenges with a TURP, like I alluded to, is that the caliber of the instrument is quite wide. Certainly when we're dealing with newer techniques, such as various forms of laser, the caliber of the instruments is narrower, and the risk of a urethral stricture, in particular a bulbourethral stricture, is less. Number two on the late complications is a bladder neck contracture. Now, a bladder neck contracture basically is scar tissue in the area of where the prostate treatment was performed. And very similar to a urethral stricture, it presents with recurrent obstruction. And we end up with scar tissue at the junction between the bladder and the prostate that gradually with time seals off and blocks off the bladder. If we look for a moment at sexual function side effects, there are two of these. One is retrograde ejaculation and the other is erectile dysfunction. Now, retrograde ejaculation is the situation whereby a man has an orgasm but no longer emits fluid. And for the majority of people, that fluid, rather than going forward out the end of the penis, can actually go backwards into the bladder. It doesn't really matter, and in many ways it's academic, the difference between retrograde ejaculation and an ejaculation. In both situations, no fluid is emitted. In retrograde, it goes backwards into the bladder. For an ejaculation, no fluid is emitted at all. And that is due to sealing off of the ejaculatory ducts, which are the pipes through which ejaculatory fluid flows when a man has an orgasm. Now, the probability of retrograde or anejaculation is actually very, very high. And I would suggest to you that it's almost going to be a certainty unless your surgeon has discussed with you the possibility of altering the technical approach to try to reduce the possibility of this happening. Erectile dysfunction is more common with a TURP than it is with other more minimally invasive forms of BPH treatment, and some reports highlight that it can be anywhere from 8 to 18% of individuals can experience a decline in the strength of their erections, the durability of their erections, or potentially not experience erections at all following that surgery. So certainly something to be aware of and to go into this procedure with your eyes open before you elect to have it done. Now, incontinence is a big concern for many men for obvious reasons. And I try and highlight to men that incontinence takes on two forms. One is called urge and the other one is stress. Urge incontinence really is related to irritability in the bladder and is not uncommon following a TURP. It always gets better given enough time. And urgency relates to that need to rush to the toilet, but getting caught short. As I say, that always gets better following surgery, but can be helped along the way with lifestyle modification or potentially certain medication. Stress incontinence is the situation whereby there can be damage to the muscle that keeps a man dry. And the reported incidence of this is anywhere up to around 10% following a TURP. It's important to be aware that this will obviously vary significantly with the size, the shape, the complexity of the prostate, and also the experience of the surgeon. But it's certainly an important factor to be aware of. Stress incontinence can be managed with pelvic floor exercises, but if still present and of significance after a period of time, there are surgical solutions for this. But stress incontinence certainly is a possibility. The other late complication really is the potential for recurrent BPH or recurrent bladder outlet obstruction related to regrowth of prostate tissue. And the figures on that, again, will vary from surgeon to surgeon, but roughly are at around 5 to 10% at around 10 to 15 years following surgery. So there you have it. They are the early and the late complications, in addition to the intraoperative complications that can accommodate a TURP operation. As always, please, if you've got comments or questions, or if you've been through a TURP, please, can you share your journey, your story with us so other men may learn from your experience? Did you get any of these complications or did you sail through this procedure? Please leave your comments in the section down below. If you'd like to know more about prostate conditions, please have a look at this video or perhaps this video here. Until the next time, please take care of your prostate and don't forget to subscribe to the channel. Thanks again.